Hello and welcome again to our Be Well for Life series, where we're talking about healthy living, things we can do to enjoy better life here on earth. You know, the Lord said in John 10:10, I've come that you might have life and have a more abundant life. And that's what we're trying to cover in this series. And today we're going to be talking about preventive health checks, things that we can do with our doctor to help identify problems before they become serious problems and take preventive actions. You know, we've been talking a lot about healthy lifestyle. And what we're going to talk about here is adding regular medical care and preventive exams so that you can have an additional advantage to enjoy that better health. Benjamin Franklin said a long time ago, an ounce of prevention is worth what? A pound of cure. Well, when it comes to medicine, that's certainly true. Now, there's three strategies that we have for prevention. We call these primary prevention, is what we've been talking about in a healthy lifestyle. That's eating well and being active and avoiding harmful substances. And then there's the secondary prevention, as we're going to zero in on today. Getting health checks, screenings. How's our blood pressure doing? How's our cholesterol? What is our blood glucose levels? Because these factors are significant, strong indicators of whether we'll have good health or not in future years. Then there's a third level, tertiary prevention. Maybe you already develop a problem, heart disease or diabetes or whatever. But by getting additional exams and taking care of those issues that you've found, or by doing rehab, whether it's cardiac rehab or a person has diabetes, there's major changes they can make in their lifespan that can still give them good health by making these changes. So we're going to zero in on number 2 and 3 on today's presentation of secondary, tertiary prevention. I like this verse in Proverbs 22, verse 3. A prudent person foresees the danger ahead and takes precautions, but the simpleton goes blindly on and suffers the consequences. That makes prevention pretty clear, doesn't it? And so there's risk factors that we have: high blood pressure, high blood glucose, high cholesterol levels, and so on. We can do something about them, become aware of them, take preventive actions, or we can ignore them. And if we ignore them, the verse calls us a simpleton, and we're going to have to suffer the consequences. So let's take a look at some of these tests of what we can do. First of all, let's look at blood pressure. Our blood pressure is very important. If it gets too high, it can damage particular organs of the body, particularly the heart and the brain. But it can also damage the eyes and our kidneys and other parts of our bodies, causing serious problems. So to keep our blood pressure in a normal, healthy range, very important. Notice, as looking at the chart there, that our blood pressure should be less than 120/80. Anytime it goes above that, there's a measurable decrease in your life expectancy. So keeping blood pressure low, very important for good health. Notice that about a third of all Americans have high blood pressure already, and another third have prehypertension. They're all not high enough maybe to be high blood pressure, but it's in that danger zone yet and causing problems. So it's important that everyone have their blood pressure checked regularly. People often say, well, how do I feel when I have high blood pressure? Well, most people who have high blood pressure don't feel anything different than anyone else. You can't realize it. I've done a lot of screenings at large corporations where we check people's blood pressures. I remember one man in particular. He worked in the metal fabrication industry. He drove one of these large cranes, the kind that it's in a big metal fabrication plant, and he's way up high, above everybody, and carrying these big heavy loads on top of where people are working and so on. Very critical job, that he do his job carefully and safely. We checked his blood pressure. It was so high that he really needed to be hospitalized. And here he was working, driving this big crane, way up in the air, very dangerous kind of situation. He felt fine. He didn't realize he had any problem. So he was happy to find out that he had a problem, went to his doctor, got it corrected. And this is what we want to do, help you to find problems early before they cause serious problem or death. Now here we see a chart, it was in the Journal of the American Medical Association, where they list the leading causes of early or premature death in the United States. And notice the first one was poor dietary habits. We talked about that. Smoking is our second leading cause of death in the United States for early death. The third one is high blood pressure. It's so prevalent, so many people have this problem, and it does serious damage to our brain and our heart and other organs of the body. So taking preventive action, very important for high blood pressure. Here's one of the early graphs that was done. If we just kind of zoom in on this graph, we can take a quick look. On the left-hand side, we see pressures of 120/80 or below. That's what's recommended, isn't it? And then the heights of those bar charts show the relative risk of developing either a heart attack, stroke, congestive heart failure, death from cardiovascular disease. Notice every time there's an increase in blood pressure, so if it goes up to just over 120/80, already a measurable increase in disease. And if it's 130/85, already a 60 to 80% increased risk of cardiovascular disease. Those are significant, aren't they? And that's just pre-hypertension. By the time we get to 140/90, it's generally considered hypertension. Risks are 2 to 3 times more likely. So these are what we call risk factors, things that we can do something about, find them early, and make some changes. Now, even if we just lower our blood pressure a small amount, one study was done where they estimated that if we just drop our blood pressure by 5 points, notice the changes it would make. 64,000 fewer deaths from heart disease, 23,000 fewer deaths from stroke, and 168,000 fewer deaths from all causes each year. Well, those are amazing numbers, aren't they? So whatever we can do to lower our blood pressure, even a little bit, can have a major, significant improvement in our health. Now, here's 7 ways to lower our blood pressure. By the way, it may be difficult to remember all of these things, so we put them in your book, and we hope that you have a little companion booklet that goes along with our presentations, where you can look up the chapter and it reviews you on these things, because we're going to have a lot of recommendations today, and it's hard to keep them all in mind, but here are specific things that you can do in lowering your blood pressure. We're just going to talk about them very briefly, and we do have a whole hour's presentation on each one of these factors. We may do at a later time, but here are things that you can do to lower your blood pressure. Maintaining a healthy weight, very important. Cutting back on salt or sodium in the diet. Most people eat about twice as much as they need. And if you can get it down around less than 2,300 milligrams per day, that makes a significant difference in blood pressure. 3, getting regular aerobic exercise. As we exercise, it's particularly healthy for the arteries, because as we exercise, the arteries have to open up, get bigger to let the blood through, doesn't it, as we exercise? And then afterwards, it closes down. And that exercises those arteries so that they stay soft and distensible, and that keeps them from becoming hardened and blood pressure being high or hypertensive. Avoiding or limiting alcohol consumption seems to raise blood pressure. Getting adequate potassium. Now, we don't think about potassium so much, but the research shows that having adequate potassium just as important in lowering your blood pressure as watching how much sodium you eat. Now, the sodium we want to eat less. Potassium, we want to eat more. The average American gets about half is what's recommended up here. And so, where do we find potassium? Well, potassium is in that next one, number 6, particularly in fruits and vegetables. Now, the DASH diet is a diet that the government has recommended. The research found to be very helpful in lowering blood pressure. And their key element in here is raising the amount of fruits and vegetables we eat daily. Notice that they recommend as many as 5 to 9 servings a day. And one of the reasons that's very helpful is because these foods are very high in potassium. At the same time, they recommend eating less saturated fats, animal fats, and solid fats. In their place, use healthier plant-based fats, and choosing more high-fiber foods. All of these have been shown to be protective in lowering blood pressure. And lastly, if we've done everything we can do, then you may need help from your doctor as well, where they could prescribe blood pressure medication that will lower your blood pressure and stop the damage from occurring. And it does make a difference. Here's a little slide that shows that, where they took a large group of people, over 306,000 people, and they all had hypertension or high blood pressure. And they looked at those who treated it with medication and those who didn't to see if it made a difference in outcome. And if we look at the graph up there closely, notice those taking the blood pressure, when they said yes, 22% reduction in cardiovascular disease. and a 13% reduction in actual death rates. So blood pressure medication, if it's needed, taken regularly, can lower your risk of early mortality, give you healthier years. Now the next test we suggest is a cholesterol check. And this is something your doctor should do regularly for you and check to see how high your blood cholesterol level is. It's one of the best predictors whether you'll still be alive 10, 20 years in the future. Now, you can see the norms there, and ideally they say should be less than 160, and desirable is less than 200. So everybody ought to be less than 200. If it's above that, you're at unnecessarily high risk and should be down. And of course, if it's too high for a long period of time, the cholesterol begins to accumulate in the artery wall, causing atherosclerosis, plugging up the arteries so the blood can't get through. This is the basic cause of heart attacks and strokes. And it also, of course, increases the risk for Alzheimer's. So these are things that we want to prevent, serious problems that can be prevented by helping keeping our cholesterol in the lower zone. So remember, total cholesterol less than 200, and if you're less than 160 or so, that would be ideal. That's based on studies like this. This is the study that was done on 356,000 people, Mr. Fit study. They took people, these 300,000 people, and checked their cholesterol, and then just simply waited for several years to see who died and who didn't from heart disease. Now notice along the bottom of the chart, if you zoom in there a little bit, we can see the cholesterol levels from less than 180 to over 245. And then on the left side of the chart, the higher the bar chart, the higher the death rate from heart disease. Notice, excuse me, notice that cholesterol levels, as they get up over 200, the risk climbs pretty dramatically, doesn't it? Already a 73% increased risk of dying from heart disease. And if it's higher than that, even higher. So very important to know what our cholesterol should be. Also, along with that, the doctor can check your HDL cholesterol levels. And HDL is different from total cholesterol. Total cholesterol is largely made up of what we call LDL cholesterol, which is an atherogenic element of fat that accumulates in your arteries. But HDL does just the opposite. It actually goes through your arteries, picks up the excess cholesterol, and carries it out of your body, gets rid of it. So that's what we want to happen, isn't it? So you can see in this chart, as we zoom in, that the higher the HDL levels, notice what happens, the risk for coronary heart disease goes up, I should say, as the HDL levels go down to lower levels, the risk of coronary heart disease goes up dramatically. So looking at that chart, what would you like your HDL levels to be? Well, if you want to be in those two lower groups, somewhere around 60 or 70, wouldn't it? And talking to Dr. Costelli, who was heads of lipid research at the time that the framing heart study was done, the very first large study like that, they said in their study, he said they didn't have one person who died from heart disease whose HDL levels were 60 and above. So you can see that's very important, isn't it? And of all the tests you can do, this is one of the most important for looking at your risk of heart health. Now notice it suggests here there's 4 things you can do in lowering, I should say, in raising your HDL levels, which is protected into your heart. Aerobic exercise is one of the best ways. People who get more exercise, they actually have greater amount of HDL in their blood, which protects them. If you maintain a healthy weight, even if you are overweight and you lose 10 pounds, your HDL levels will go up. Stopping smoking, your HDL levels will go up. And the last one there, a little different, limiting sugar and soft drinks and refined foods. When you have a high intake of sugar, that suppresses HDL and again raises your risk for heart disease. So there are positive things we can do to keep that in the healthy range. Now, the very latest, newest data shows that a figure called non-HDL cholesterol is the most important way of evaluating our overall risk because it takes both of those kinds of cholesterol into effect. Now, the total cholesterol is made up of both good and bad cholesterol. The good we called what? HDL cholesterol, didn't we? And the bad was the LDL, but there's others that go along with that, like the very low density lipoproteins, the LDL, and there's IDL, intermediate density lipoproteins, but they're all atherogenic. They all raise our risk for heart disease. So if you take your total cholesterol number Subtract the HDL cholesterol from it, and what do you have left? All the bad cholesterol. Now, the number you need to keep in mind for evaluating bad cholesterol, or the non-HDL cholesterol, is the figure of 130. If your non-HDL cholesterol is 130 and below, you have the lowest risk. And that's what you can see here in the chart. Notice if it's less than 130, your risk is the lowest, and every time it goes up from that, there's a significant increase to your risk is 2, 3, maybe 4 times higher if you're up around 200 and above. So that's the best way to evaluate your overall risk. And that's what this chart shows here. It's kind of detailed, but you can see again along the bottom is the number of years of follow-up, and on the top, the percentage of people who have accumulated percentage of cardiovascular disease. And as you can see over time, the risk goes up for heart disease, but much lower when your non-HDL cholesterols are in that low, healthy range. And every time they go up, you can see there's an increase in risk for total mortality. So here's the two numbers to remember: total cholesterol less than 200 and your non-HDL cholesterol less than 130. If it's above that, you're at unnecessarily high risk and you need to bring it down. And what we're talking about here can help you do that. You may also need your help from your doctor because there's medications that can also help you to achieve that. Now, in this Mr. Fit study where they had the 360,000 people, they found this result. If your cholesterol levels were less than 200, in other words, in the range they should be, if your blood pressure was 120/80 or below, the healthy range, if you were a non-smoker, if you didn't have diabetes, and if your weight was in the healthy range, notice that they reduced the risk of heart disease by up to 82%. Well, that's good news, isn't it? Heart disease is our #1 killer in the United States. But keep in mind that it's reducible by 80-some% if people just keep these 5 risk factors in control. So that helps us to give us courage that there's something we can do, isn't there, to reduce our #1 cause of death. Also, those people live, notice, 6 to 7 years longer. So it certainly has advantages. Now here's one of the most interesting studies that's ever been done, in my opinion, on cholesterol and its risk for projecting our risk for the future, whether we're going to be alive or not, in this case 30 years later. So they took a group of medical students all coming to medical school. They checked their cholesterols at the very beginning, and then they followed these students for 30 years to see who lived and died, who had heart attacks, who didn't. They divided them into 2 groups. The first group in the yellow were those people whose cholesterol levels were in the bottom 25% of the group. In other words, they had the lowest total cholesterol levels. That in the pink bar, those group of students, 25%, who had the highest cholesterol. So they just divided the class into those 2 groups, waited 30 years, and these bar graphs show you the results. Notice that heart disease almost 12 times higher in those that were in the higher cholesterol group. And those, and for all cause of death, almost a 3 times increase in mortality. Well, those are huge differences, aren't they? And remember, these were all medical students. They could have learned about ways to lower their cholesterol and keep it in a healthy range. But sometimes doctors are humans too, aren't they? And don't always accomplish everything that could be done. But it does certainly illustrate maintaining a healthy cholesterol, so very important. Let's take a look at the actual arteries and what happens when our cholesterol gets high. Notice there's an outside layer, that kind of yellowish layer. It's called the adventitia. That's largely a connective tissue layer. And then underneath that is a red layer, and that's the media, and that's largely a muscle. The arteries are a muscle, so they can expand and contract as needed to adjust our blood pressure, to let more blood through if we're exercising, and so on. And then on the inside of that should be a very thin, smooth layer called the intima. Actually, it's just 1 or 2, a layer of cells just about 1 layer thick, so it's extremely small. In here, we see the intima is quite thickened, and it's showing what happens when the cholesterol levels get high and the blood pressure is high, which makes it enter the artery faster, and that artery becomes plugged up. The opening gets smaller and smaller, doesn't it, as the adventitia gets thicker. So let's look at some actual arteries from actual hearts. And here we're looking at the end onto the artery. And notice how thick the wall is here. This artery is already showing moderately advanced atherosclerosis. The distance, the thickness of that wall is almost as wide as the opening, isn't it? Now the opening should be at least 5 times wider than the outside layer of that artery. So already that artery is severely compromised. However, the person won't have any symptoms yet because that artery has to be 90% plugged before it actually gets symptoms such as heart pains or that kind of thing. So disease may be there, but people don't recognize it yet when the cholesterol is high. Now here's an artery that has severe atherosclerosis. Where's the opening? It's just non-existent, isn't it? Maybe right in the very middle there's a little spot where the blood might be able to sneak through a little bit, but essentially it's plugged. And of course that's why we have the slide. The person didn't make they died because that artery plugged up and then their heart quit beating because it didn't have enough oxygen. And this is the #1 cause of death in the United States. Remember we said it's up to 80% preventable. And probably the best indicator is keeping our cholesterol levels low. Now, how do we lower LDL cholesterol levels? Well, we're just going to run through these quickly. There's 7 recommendations here made by the National Institutes of Health and so on for keeping the heart in good health. And again, these are in your book if you can't remember them all. But again, keeping the weight down, very important. Every excess pound of fat that we have in our body produces extra cholesterol, which can accumulate in our arteries. Limiting saturated fat. Saturated fat are those solid fats or animal fats. And when you eat a lot of these, the cholesterol levels in our body seem to go up very quickly. So cutting those out can make a huge difference. Some examples would be butter. Of course, all the red meats with all the saturated fat in the meat. High-fat dairy like in ice cream and cheese. Deep-fat foods, deep-fat fried foods. These are all foods that have high cholesterol and high saturated fat and ones that we'd need to minimize. In their place, we need to use healthier fats. Plant oils. Things like extra virgin olive oil or sunflower, corn, soy, canola. All of these are healthy fats. They actually help to keep the cholesterol low. And by adding a little healthy fat, it also keeps your HDL levels up so that they don't fall like they do on a very low-fat diet. Then also, foods with healthy fats. These are good, healthy, heart-healthy foods. Avocado. Some studies have been shown that as you eat more avocados, your blood lipids improve, showing your risk is lower. Olives, nuts, nut butters, flax meal, tahini, all of these things, hummus. Good, healthy fats we can use in place of the saturated fats to keep our heart healthy. Then it's suggesting eating unrefined foods high in fiber. And let me tell you just a little bit about fiber. Fiber is helpful because it helps to get the body, to rid the body of excess cholesterol. Remember we said about the HDL, how it goes through your body and picks up the excess cholesterol, takes it to your liver, and there it's excreted. Well, when it's excreted, it's actually made into bile salts, which go into the intestinal system, which help you absorb fats in your diet. Then after the fats are absorbed, the bile salts go down further in the intestine, and then they're absorbed and recycled and used again, unless you have a high-fiber diet. If you have a high-fiber diet, it traps those bile salts so they can't be absorbed. They're passed through the body, they're excreted, and your body needs to make more bile, so what does it do? It pulls more cholesterol again out of your bloodstream, and this helps to lower the cholesterol that's accumulated in your body. So this is the only way we can get rid of cholesterol in the body. So high fiber foods, and particularly soluble fiber, particularly helpful. You'll see some foods listed there. Oats, oat bran, very good in lowering cholesterol. Barley is a very healthy grain. The pectin-rich fruits, actually that pectin is a type of fiber that traps cholesterol and holds it. And other foods that are very high in those are the legumes and lentils and beans and psyllium. One that you don't hear a lot about, but it's a high fiber that's put in Metamucil that helps with constipation, but also very effective helping to lower your cholesterol. It's just a natural fiber, very helpful in lowering cholesterol levels. And of course, certain vegetables and so on also very good. Along with that, the whole grains in place of the refined grains, so the whole wheat breads, the oatmeal, brown rice, those kinds of things are helpful. And again, more fruits and vegetables. Number 5 is limiting the refined carbohydrates, particularly the sweets and the soda pop and those kinds of things. Remember, they raise the triglycerides. That would be the VLDL in the body, the VLDL cholesterol. Those are all atherogenic. And so they raise our risk. And they also help to suppress HDLs, the high sugar does. So be careful of the sweets. Try to eliminate those or keep them in moderate amounts. Number 5 there, eating nuts, nut butters, and seeds daily. A lot of research has been shown on nuts, and of any group of food, they're most helpful in lowering our risk of heart disease. So even though they may have more calories than other foods, and they're high in fat, it's a healthy fat. And they actually help to lower our cholesterols. All the studies show that we'll live longer lives if we eat a handful of nuts every day. It's an easy prescription, isn't it? Not difficult to do. And the last one there, getting regular physical activity. Exercise, remember, it raises the HDLs, also helps to burn up the triglycerides, the VLDL, atherogenic cholesterol. All of these help our arteries to be healthier and have an overall healthy cholesterol level. Now, blood glucose level is the next one. These 3 first risk factors we're talking about, very key factors in preventing chronic disease, which is our major cause of death in the United States. But as our blood glucose levels get too high, they damage our brain, arteries in the brain. They damage the arteries in our eyes, causing blindness. Damage the little arteries in the kidneys, causing kidney failure. Damage our arteries all over so that the cholesterol deposits faster. Very serious to our health. So to have good cholesterol or good glucose levels, you want to keep them in the normal range. You'll notice there that it's less than 100. About 70 to 99 is considered normal. Actually, the 70 to 90 is ideal. 90 to 99 is sometimes called high normal because there's already shows some risk. And then if it gets above 100, we call that prediabetes. 100 to 125, this is based on a fasting blood test. That's called prediabetes, already causing damage, but not as much as diabetes yet, but it puts you in a higher risk group. And then if it reaches 126 and above, by definition, that's diabetes. So those are the standards to keep in mind, and you ask your doctor to help you get those blood tests done regularly. So already today, 1 out of 9 adults already has diabetes. That's a lot of people, isn't it? And 1 out of every 3 has prediabetes. So we can see that it's a major health problem. And for example, Medicare tells us that diabetes is our most costly health problem in the United States because it causes so many complications, so many other health problems. Notice an expense there. People with diabetes 2 to 3 times more likely to have high medical expenses than people without diabetes. And here's the reason. Notice this list of complications. And remember, we're trying to focus on we need to prevent this. Because if we prevent it, we can prevent these complications. Diabetes is the leading cause of new cases of blindness, kidney disease, amputations of the leg, increases the risk of heart disease by 2 to 4 times, increases the risk of stroke by 2 to 4 times. People who have diabetes are more likely to have high blood pressure, and the two work together to cause significant damage. Doubles our risk of Alzheimer's disease. As we get older, we want our brain to work well, don't we? So keeping that blood sugar level down is one of the positive things that we can do on that. And of course, it cuts short our life. On an average, about 5 to 8 years takes off our life. So we need to keep the blood sugar low, and if we do, it stops that damage from occurring. Now, if the blood sugar is too high, we can also recognize sometimes by symptoms. Unusual thirst and frequent urination. As the blood glucose gets too high, it begins to dump in the urine. And as it dumps a lot of that, then we need to drink more and more water to stay hydrated. So excessive thirst and urination is a sign. We may have diabetes. Extreme hunger, same reason. Unusual weight loss, losing a lot of calories as it dumps that sugar into the urinary system. It causes extreme fatigue, irritability. If the blood sugar is high, the immune system is affected, and sores and so on don't heal as well, cause problems, frequent infections. Sometimes it can affect our vision, and sometimes it also affects the nerve, can do nerve damage, and cause tingling and numbness in the hands. So if we see any of these signs, and you haven't had your blood sugar level checked recently, ask your doctor to check them, because they could indicate a serious problem there. Now, let's look at the positive aspect of prevention. The American Diabetes Association did some studies, and they recommend 2 simple things that we can do that cuts your risk of diabetes in half. And what are they? Walking briskly about a half an hour every day, and maintaining a healthy weight. Or if you're overweight, even just losing 10 or 15 pounds. Doing these 2 simple things can cut your risk of diabetes in half. Isn't that amazing? So it is preventable, things we can do to prevent it. Now, Harvard University did a study on 80,000 women and looked at what it was that they could do to lower the risk of diabetes. They found 4 major risk factors. And they are overweight. People are overweight, much higher blood glucose levels. What overweight seems to do is it makes your body resistant to insulin. And when your body can't use insulin well, which lowers our blood sugar normally, helps it to go into the cells, then your blood sugar levels get higher in the blood. A sedentary lifestyle. Exercise works much like insulin. It helps the blood sugar to go into the cell where it is used, where it needs to be. But if we don't exercise regularly, again, more likely to have insulin resistance and higher blood sugar levels. Smoking does the same thing, and poor diet. In poor diet, they looked at specifically 3 factors that were important. If you had a high intake of sugar and sweets, that raised the risk. If you ate a lot of refined white bread products and white rice and white pasta and all the refined grains, that seemed to raise the risk. Potatoes were one of the factors too, one of the foods that raised the risk. Potato starch, absorbed very quickly, raises the blood sugar levels nearly as fast as sugar would. So, and then the last thing was a low fiber intake. Fiber, again, seems to be protective, and it helps slow the absorption of glucose in our digestive system, keeping the blood sugar levels low so it doesn't get up into that high damaging area. So if they didn't have any of these risk factors, notice in the chart there, person with no risk factors, their risk on a relative scale from 1 to 100 was only 11. People who had any of those risk factors in that other chart, notice their risk was 100. In other words, 10 times higher than people with no risk factors. See, that's a huge difference, isn't it? And they found that even if you had a history of diabetes, if you didn't have any risk factors, you reduced your risk by at least 90%. Well, that's good news again, isn't it? We can do something to prevent this serious problem. All right, let's look at cancer. I think we all are agreed. We don't want to get cancer. It's a serious problem. It's the second leading cause of death in the United States. And for people under the age of 80, it's actually the leading cause of death. So anything we can do to prevent cancer is very important. We've talked about lifestyle factors before, but also getting preventive checks. Checking to see early on if there's a problem. Because the earlier you can find cancer, more successful you'll be in treating it, won't you be? So men, checks for prostate cancer. Women, checks for pap tests for cervical cancer and mammograms for breast cancer. Some very common cancers in women. And for both men and women, colorectal cancer screening and checks for skin cancers and oral cancer checks. These are things that you can look for early. If you find them early, again, much more likely to be successfully treated. So let's look at some of these tests. Colorectal cancer check. The doctor here is showing the instrument that's used. Basically, it's a bright light and a camera. And they're able to, after the colon is cleaned, they go and look through the colon and see if there's any early signs of cancer. And we'll look at some of these pictures here in just a moment. It's very important to get this test, and especially as you get older and reach the age of 50 and above, that's when the cancers are most likely to occur. And if you get that test done then, you can significantly reduce your risk of cancer. Most people, studies show that by over 90%. And bowel cancer is the second leading cause of death. It's One higher is lung cancer. We know what lung cancer is caused by, don't we? Smoking. So getting this checked, a very positive thing that we can do. So when I turned 50, I went and picked up the phone, called the doctor, and made an appointment for a colorectal cancer check for my wife. Brave man that I am. I thought she ought to get hers checked. She was a little older than I. So we got her signed up first, and she went through, and she survived, and so then I made an appointment for myself. Well, when I went into the doctor, I wanted to see what the inside looked, and so I asked him, don't put me out. I want to be able to watch as you watch. So he had a TV screen there where he could actually see the cameras that are going through to look for any problems. And what they're looking for are little colon polyps. Now here you see quite a large size one. If we zoom in on that screen, you see that growth on the inside of that intestine there, or large bowel. That's actually, looks like a mushroom, doesn't it? It's got a little stem at the bottom and the round top. This is a polyp. It's not cancerous yet, but it's forming a cancer. And if they can take it out at this stage, then they can prevent the cancer from developing. So when I had mine done, we were going through the colon, and it came around a corner, and sure enough, there was one of these little polyps, not very big, but he says, let's take that out. So out came a little scissors right in the instrument they're using, nipped that off. I thought it was going to hurt, didn't feel a thing. Doctor explained that there's no pain receptor sites in that part of the colon. And so it took care of it, and he says, now you're good for another 10 years. And if they can catch it early, you see these polyps grow slowly. If they can catch them early, take them out, then you keep the cancer from developing. And so they recommend this test at least every 10 years. If you have a lot of polyps and you're higher risk, the doctor may recommend it every 5 years. All right, so now let's just review quickly too. What are things that we can do to prevent colon cancer from happening in the first place? Getting regular exercise, one of the most important things you can do. Exercise stimulates the bowel to move food through it quickly. And by doing that, it eliminates the time exposure for any cancer-causing agents that might be in the food we're eating. And so a faster transit time or a shorter transit time to faster get it out of our body lowers the risk. Limiting the intake of red and processed meats significantly reduces the risk of colon cancer. Maintaining a healthy weight. Again, eating lots of fruits and vegetables. They seem to be good for just about everything, don't they? So eat lots of those kinds of foods. The whole grains are protective. Not smoking, and of course, again, not drinking. Alcohol seems to raise the risk. And then, of course, getting your colonoscopy once every 10 years or so after the age of 50 can significantly almost eliminate the risk of colon cancer. Another very common test that are recommended for women are for cervical cancer, and they're called the Pap test. And you can see the recommendations there. Talk to your doctor, but generally, after a certain age, they like to have all women checked for this. And if there's any early growth of cancer in the cervix, by taking a little scraping of that area and looking at the cells under the microscope, as you can see on the right there, and if there's cancer cells developing, they will be stained a different color, and they stand out, and you can see it very quickly, and then they can take steps to treat that before it spreads to the rest of the body. You know, cervical cancer is caused by an infection, by the HPV virus. And so important to prevent that. There's two things that you can do. You can get an immunization now as a young teen to prevent that. And of course, that virus is passed from sexual activity. And so if you only, both of you, as you get married, have only had sex with one partner, you will never get this infection, and you never have to worry about this disease. But the more sexual partners there are, the higher the likelihood of the disease, and so it's recommended that young girls have a immunization, prevents that, and then that prevents it from occurring. Mammography, of course, is looking for early breast cancer, and it's recommended for all women over the age of 40 or 50, however your doctor recommends. And you can see in the x-ray there on the right, a little white spot showing new growth of breast tissue. If you can find that early, very early stages, long before you can feel a lump or anything, they find it very early, they can do a surgery, do a lumpectomy or whatever, take that out, and prevent the development of a full breast cancer, which of course can take a person's life. So recommendations, again, every 1 to 2 years over the age of 40 or 50, ask your doctor what they recommend. Follow those recommendations. Now, just again, let's review some of the things that we can do ourselves to prevent breast cancer. Remember, it's the most common cancer for women. Limiting alcohol. Any intake of alcohol raises the risk for breast cancer, so ideally is none. Not smoking. Keeping your weight down. As your body weight goes up, certain hormones, estrogen and so on, increase in the body, and that increases the risk for breast cancer. Being physically active. One of the most positive things you can do is exercising regularly, and that has a positive effect on reducing the risk of breast cancer in women. Other things that have shown to be helpful is breastfeeding your baby, if you have a child, limiting hormone therapy, getting regular preventive checks, of course, as we looked at, and overall eating a healthy plant-based diet, or the Mediterranean diet has been looked at a lot, where these foods high in the fruits and the vegetables and the whole grains and the fiber and so on, but particularly low in red meat, seem to be protective for breast cancer. All right. Now, the most common kind of cancer for men is prostate cancer. And notice in this prostate cancer, again, around the age of 50, it's recommended that you get some exams, tests that can be done to see if you are at increased risk for prostate cancer. There can be a digital rectal exam that can actually feel the prostate, see if there's any nodules or growths developing, or there can be a blood test, the PSA or prostate-specific antigen test, and if that begins to get too high, then the doctor will say, well, we maybe need to check this further, because as the prostate cancer grows, PSA levels increase. So when I turned 50, I said, well, following my recommendations, I guess I ought to get my PSA test done. I took the test, and it was higher than the doctor liked. She said, well, we're going to do another more specific PSA test and see how that does. And when they took that one, it was even higher yet and showed more problems. So we said, well, we better do what do you call it? Where they check the actual cells to see, a biopsy, thanks. A biopsy to see if they actually are growing any cancerous cells. And they did, and they took 10 samples, and out of the 10, 6 of them showed cancerous cells already. I had just turned 50, so it can begin very early. And they checked the PSA levels again, and they were climbing very rapidly, so the doctor says we really should do surgery, take that out, before it spreads to the rest of the body. And they were able to do that by catching it early, doing the surgery early. They were able to catch it before it spread outside and spread to the rest of the body. Now, at the same time, I got my tests. My brother-in-law also had some tests done, and they found out he had prostate cancer as well. But because he was 10 years older than I, it had already spread outside the prostate and gone to other parts of his body, including the bones. And that's much more serious. There's some things they can do. Radiation can help, and they can give medications that help. But he lived another 10, 12 years and then died from prostate cancer. Fortunately, by catching mine early enough, I was able to prevent that. And for 30 years now, have not had any problems. Well, 25. I'm not quite that old. Now, what are some other things we can do to lower prostate cancer? Again, eating more fruits and vegetables. That comes up in a recommendation for almost everything, isn't it? Those foods have protective items in them that's helpful. One of the things that's protective, particularly in tomatoes, is lycopene. And that seems to be protective. It keeps the prostate healthy and prevents cancer from growing. And particularly, the kind of tomato products are like tomato paste or tomato sauce, where it's been cooked, and also where fat has been added, like olive oil. Because the olive oil in the tomato product helps you to absorb the lycopene, and that reduces your risk. In fact, one of the latest studies out of the Adventist Health Study, again, has confirmed that. Just came out, read it just a few weeks ago, that tomato products, along with a little healthy olive oil, reduces your risk of prostate cancer. Other studies show that eating less saturated or animal fats is helpful. Maintaining a healthy weight helps. And limiting dairy. Many people many studies have shown that as the increase of things like milk intake and cheese and so on gets higher, your risk for prostate cancer goes up. And so the new recommendation by Harvard, in their nutrition department at least, says if you're going to use milk, drink no more than 1 glass a day. Men who had 2 glasses a day or more had significantly higher prostate cancer rates. Another positive thing you can do is exercise. Exercise, again, seems to lower the risk of most cancers, and particularly prostate cancer, and of course, getting your prostate exams, positive things you can do to reduce your risk of that special cancer. Now, your doctor may have other preventive tests that they want to do too. If you've been a smoker, there's tests they can do now to check for lung cancer, looking for oral cancer, cancer of the mouth. If you live in the sunny south and you get a lot of sun exposure, your risk for skin cancer, of course, is much higher, and you can do skin tests. I go at least once a year now that I'm over the age of 50, and the doctor looks for skin cancers. So far, we haven't found anything. That's good. We'll hope that will continue. Then there's, of course, other things, the doctor's tests that they can do. Just go over these tests with your doctor. Make sure you get them done regularly. Then also, when you're at the doctor, doctors should do some counseling of things that can do to help reduce our risk of cancer. Checking for smoking and helping a person to stop smoking. In this high sun exposure area, living in the south, very important to wear protective clothing, hats, use sun lotion if you're out in the sun, minimize our sun exposure. Again, significantly reduce our risk of that cancer. And then there's healthy things we can eat in our diet, as we've talked about, getting exercise, safe sexual practices to prevent transmission of some of the cancers that way, and environmental exposures. Smoke, for example, and exhaust from our cars increases the risk of cancer. So let's look at things that we can do to minimize our risk. Some other preventive checks are important as we get older: our hearing, our vision, dental exams, and so on. We'll take a quick look at these. Immunizations right now is something we're very interested in, concerned about. We're right in the midst yet of the COVID-19 pandemic, and now there's immunizations or vaccines that you can take to get your immune system aware of this virus and take actions to prevent it from occurring in your body. Now, there's 2 ways to get immunized. One is you can get the disease, and that activates your immune system, but you may not survive. The safer way is to get a vaccine. It does the same thing. It activates your immune system, helps it to recognize the virus. When you get exposed to it, then your body responds very quickly and takes care of it, and you don't come down with the illness. The new one is very effective, about 90% effective, so that's very important. And of course, other ones is your annual flu shot. For persons over the age of 65, getting a immunization for pneumonia, very important. Diphtheria every 10 years or so. Pertussis. Your doctor knows all of these, and just to work with them, making sure you keep them up, it can significantly reduce our risk of these serious problems. Shingles shots now are available for people over the age of 50. Shingles is very serious and very painful disease, and can be prevented largely through immunizations. And of course, we mentioned COVID-19, didn't we? So talk to your doctor, make sure you're keeping current on all of these, and your children as well, because most of the children's diseases, when I was young, we all had measles, and we had mumps and chicken pox and all these different kinds of children's diseases, and most of these now can be eliminated. And when you eliminate them, they of course eliminate many other serious complications, including death. So that's been very helpful. Now, here's a study that was done, I believe it was done in Sweden, and they have a healthcare system for the whole nation. It's easier for them to keep records, and so they were able to do this study. And they simply looked at the benefit of getting a flu and pneumonia immunization in people over the age of 65, and how it affected hospitalization and early death. So they studied 260,000 people and over the age of 65, and then they just asked them, have you been vaccinated for the flu and pneumonia, either yes or no? And as we look at that chart a little closer up, you can see there's quite a difference, isn't there? Those who said yes, they were vaccinated, the one on the left, their death rate was less than half. Those people who said no, they were not vaccinated. So mortality from all causes was 57% lower in those people who got their vaccinations. So immunizations do save lives, and we encourage you to get them. Before we go on, let me just say this about immunizations. Some people are concerned, particularly of the COVID-19 immunization, that they might actually get the disease by getting the shot. And CDC in their site has made a statement that there's no way that you can get it because they don't actually give you the virus. They give you just a very small portion of it. If you've seen a picture of the virus and has these little spikes that stick out all around it, those are proteins. And what they actually give you is a immunization that causes your body to recognize those little proteins that are sticking out on the virus and to produce that protein, and then your immune system recognizes it and sets up its defenses against that virus, but you don't actually have the virus in your body. Another common misconception is and you've seen this on the internet, I've read it myself, where it says if you take this immunization, it will change your DNA for life. Well, that's not true. That doesn't happen. In fact, the immunization that goes in doesn't even go into the nucleus where the DNA is located. And so it has no effect on the DNA, simply causes your cell to produce that protein, which causes your immune system to be activated to recognize that and then protects you from COVID-19. So these are positive things we can do, can save many lives. We recommend that you take advantage of those. Talk to your doctor about it if you have concerns, ask questions, and talk it over with them. Hearing, of course, as we get older, again, much more common, and there's hearing tests that you can do regularly, many of them even free. They'll go in and get your ear hearing tested and see if you need help in that area, and that's important. And vision, eye exams, the same, especially as we get older, past the age of 40, and they recommend a yearly exam where they can check for glaucoma and retinal problems and cataracts and so on. And there's treatment for these issues. Take care of them early when they find them, help you to have better vision. Same is true for our teeth. If you don't want false teeth, the doctor says you have to be true to your teeth. And getting exams regularly, once or twice a year, is important. Flossing, as you can see here, again important. And as we take these preventive steps, it can significantly reduce the loss of teeth as we get older. There was this little sign in my dentist's office, maybe you've seen it. It says you don't have to floss all of your teeth, just the teeth you want to keep. So keep that in mind if you want to keep your teeth for a lifetime. So in summary here, let's just go over this. It's important that we get regular medical care and preventing exams along with our healthy lifestyle that we've been talking about. If we do both of those together, it gives us the best advantage for a longer, healthier life, doesn't it? And if we do have health problems, we want to take care of them right away. We found that in COVID-19 and the problems that we've had here, it's the people who have these additional health problems that get into the real serious problem and have the higher risks. So let's take care of them early. If you have a problem with high blood glucose or high cholesterol or high blood pressure, ask your doctor for clarification if needed. What you need to do, specific guidance. What do I need to do to handle this problem? And asking for help in making lifestyle changes if needed, and losing weight or stopping smoking or some of these other difficult changes. The doctor is there to help you. And by working in partnership, the two of you together, again, it gives you the best advantage for your long survival and best health. Well, let's just take this little quiz in summarizing and to finish at the end here, shall we? An example of secondary prevention is, what's the answer? Well, it could be checking your blood pressure, cholesterol, your glucose levels, looking for early signs of disease, perhaps before they've actually caused the disease, but just the high risk factor. Number 2, what is a normal blood pressure or healthy blood pressure? Less than 120/80. Anything above that does damage to your body and needs to be brought down. Number 3, Name 4 lifestyle actions that can lower your blood pressure. Well, remember there were 7. Let's see if we can come up with at least 4. Keeping your body weight down is very important. One of the biggest risks for high blood pressure is our body weight going up. Getting regular exercise, very important. Reducing the sodium in our diet, very important. And remember we said potassium was very protective. And we get that from where? Lots of fruits and vegetables. And they're high in potassium. So those are all protective. And also eating foods high in fiber can help keep our blood pressure lower. All right, number 4, cholesterol levels should be less than what? Well, for everybody, remember, it should be less than 200 milligrams per deciliter. And if it's less than 180 or even less than 160, that's ideal. Very low risk of heart disease if it's less than 160. We also talked about non-HDL cholesterol. Remember, we said that should be less than 130. Number 5, the most important actions to lower your cholesterol level is, well, again, remember it had 7 recommendations. Let's look at the most important ones. Reducing our intake of saturated fat. That's the animal fats. Using a healthier plant-based oil or things like nuts and olives and avocados are healthier fats. Reducing our excess body weight. Remember, every excess pound of fat raises our cholesterol. Getting regular exercise, very important. Did we get 4 yet? Watching the refined carbohydrates, the sugars, the refined white flour, and so on. Also very important for keeping our cholesterol down. And if needed, doctor can give you a medication to help lower that. All right, what do we have here next? Number 6. What 4 lifestyle actions can you take to raise your HDLs? Remember, they're protective. We want our HDLs as high as we can. We find that keeping our weight down, not smoking, exercising, and watching the sugar. 4 key things that we can do in making our HDLs higher. And remember, we said that's probably the best test we have today that shows our risk of cardiovascular disease. So very important. Number 7, what is a healthy fasting glucose level? Remember, we said it should be less than 100, and even more ideal, less than 90. That gives us the lowest risk. If it gets above those levels, then damage begins to occur. And can damage the arteries in our brain, and our hearts, our kidneys, our eyes, different parts of our body, cause these serious complications. So keeping that low is important. And then number 8, what are 4 things we can do to lower our risk of diabetes? Remember the Harvard study? They found that eating a healthy diet, particularly high in fiber, low in saturated fat, and low in sugar and refined carbohydrates, those are the dietary things, and then keeping our body weight down, exercising, and not smoking. And if we eliminate those risk factors, they estimate that 90% of all diabetes, mature onset diabetes, could be prevented. That's amazing, isn't it? So there's a lot that we can do to enhance our health. Number 9, at what age should a person get a colon cancer screening test? Remember that magical number? At least by 50, unless your doctor recommends it earlier for some other reason. So as we get older, it's important to get those tests, and the others as well too, of course, the mammograms and the pap tests and the prostate exam tests. And number 10, what immunizations are recommended for persons 65 and older? Well, talk to your doctor about it, see what he recommends. But certainly getting the flu shot annually, getting the new COVID-19 immunization can be very protective and helpful for us. Getting a pneumonia immunization once every 10 years after the age of 65. And remember, then the, what was the last one? Shingles. Good for me to review these. That's why they're in the book, by the way, if you can't remember. Look them up in the book. But a shingles shot past the age of 50 or so, again, helps to prevent that very painful disease from occurring. So these are steps we can take. We hope that as you put them into practice, you can enjoy better health. And again, we encourage you to take your book and go through at the end there, keep track of the good things that you're doing in your lifestyle, talk to your doctor, make sure you're current on all of your immunizations, get these preventive exams. As we do these things, we have the best chance for a long, healthy life. And put these things into practice each day. Encourage your family and friends to do the same. And we'll look forward to seeing you the next week in our next presentation. Thank you.